ready to go?
Yes,
Good afternoon. This is the Board of Health meeting for Thurston County, November 8th, 2022. I'm the Vice President of the, or Vice Chair, I guess, of the board. The board chairman, Ty Menser, is not available today. And so we're gonna get right into the activities for today. But first, I would like to have everybody at the table introduce themselves all the way around. Doctor?
Hello, I'm Dr. Damiana BoH. I'm the Thurston County Health Officer.
Okay, we got another doctor.
I am Dr. Beth Harvey. I'm a pediatrician at Thurston Pediatrics.
I'm Ron Vasquez. I am the Lacey City Council member who's represented on the Board of Health.
Maria Williams, Program Manager for Community Agency and Psychologist for Behavioral Hospital.
Carolina Mejia, Board member and Thurston County Commissioner.
Okay, for those of you that may be joining along today, we are here today as a new board because of House Bill 1152 that said the Board of County Commissioners, that also is the Board of Health in Thurston County, needed to change its ways, along with several other counties throughout the state. And this is reflecting that change. So that's our new activity. So if we seem a little green, it's because this is our first real official meeting where we've got everybody in attendance. And we're gonna be selecting officers here a little bit later. But as we get going, I will ask that someone make a motion to approve our agenda today.
I would move to approve the agenda for November 8th, 2022.
Do I have a second? Second. Okay. All those in favor, and I'm gonna forego the vote at this point individually. I'm just gonna say, all those in favor say aye.
Aye.
And is there any opposed? Hearing none, the agenda is approved. Next is the opportunity for the public to address the new Board of Health. Is there anybody here in attendance in the room that's interested in testifying today? Have we seen anybody in the hallway just breaking down the doors, trying to get in? Okay, how about any Zoom participants?
No, sir.
So there apparently is no one here to testify today, and so I'm not gonna go through all the rules that apply to public testimony. And now for department items, and we're gonna refer this to Kurt Harden, our Public Health and Social Services Interim Director.
Good afternoon, board members. Kurt Harden, Interim Director for Public Health and Social Services. I'm going to give you a presentation and an overview of the Public Health and Social Services Department. This is probably going to be a little fast and a little more, won't go too deep. I want to invite any board member who wants to come by and we can do a more in-depth one-on-one discussion about the Public Health and Social Services Department at any time you want to. So feel free to reach out. As we get the slides up, there we go. Jamie's going to be my slide flipper. Thank you. So the work of the Public Health and Social Services is governed by the Thurston County Board of Health and also by the Board of County Commissioners. The Public Health and Social Services is comprised of 6 divisions and offices, which includes the Community Wellness Division, the Disease Control and Prevention Division, the Environmental Health Division, Vital Services Division, the Office of Housing and Homeless Prevention, and the Treatment Sales Tax Office. And as you can see, as we look at our mission, working together to achieve the highest level of health and well-being for everyone. Next slide. And then as we look at it, assuring conditions where children and families can develop as healthy, productive members of the community, thereby reducing future impact on the criminal justice system and other systems. And here's our strategic goals as we look at these. The first one, achieve organizational excellence. The second one is advance equity. The third one is protect human health. The fourth one is promote healthy behaviors. The fifth one is support well-being. And as we look at our strategic goals and our vision and values as mapped out in our 2020 through 2024 Thurston County Public Health and Social Services Strategic Plan, we have the vision of thriving, hopeful, healthy communities where all people are safe and supported and our environment is protected. And then values are integrity, leadership, service, excellence, hope, compassion, wellness, and inclusivity. And you'll, as we look at the, I think we skipped one slide, but, no, okay. We'll move on. Here's the breakdown as you look at it. Obviously, you have the community, then you have the Board of County Commissioners, and then the Board of County Commissioners appoints the Board of Health. And then from there, you have the director. We have an assistant director and a health officer underneath the director. And then you have the 6 different divisions as we look at the various areas. Next slide. The areas that we have are treatment sales tax, housing and homeless prevention, disease control and prevention, environmental health, community wellness, education, and vital services. So community wellness, education, as I look at these and community wellness and education, I'm flipping to my slides. I think they're a little out. I have a different order, so somehow we sent those out of order just a little bit. So bear with me just a minute. What's that? There we go, yeah. Thank you. So under housing and homeless prevention services, we have the breakdown underneath there for all the different areas. And they're broken down into the areas of affordable housing, community development program, homeless services program, homeless crisis, and then also regional housing council area. And so as we look at those areas, you can read underneath all these under affordable housing. You have the grants contract management, program compliance, community engagement. Same with community development program. You can see all the different areas that the housing and homeless prevention services touch. Next slide. Disease control and prevention. Underneath there, you have epidemiology and assessment, and then syringe services, opioid response, and investigation and control of disease. And you can see the various areas. I'm not going to read all of them out loud. Underneath disease control and prevention services, one of the areas that you should look at under opioid response is our opioid response task force. The plan for the opioid response task force expires on December 31st of 2022. And so that will be discussed later this afternoon as to whether to add that to your agenda for December so we can take a look at the opioid task force response plan. Environmental health services. We have underneath environmental health services, you have food and environmental services, drinking water, and then on-site sewage systems monitoring and maintenance, water quality, and solid hazardous waste. And then you can see all the different areas underneath the environmental health services. Under vital services, we have public information, administrative services, emergency preparedness, and fiscal. And what you should know under vital services is this is where the public comes in to get birth records, death certificates, other vital public health certificates and documentation at our location at Lilly Road. So for our community wellness education, we have that broken down into maternal child health, community education and prevention, and social services. And then under maternal child health and also nurse family partnership services, you can see under you have child death review, children and youth with special health care needs, community conditions, education and outreach, family intervention, developmental screening, and blood pressure monitoring program. For community wellness education and prevention services, we have substance use, injury, and suicide prevention, chronic disease prevention, and environmental health education and outreach. And then you can look underneath all those and see the different areas underneath each one of those. And then for social services, we have veterans and we have developmental disabilities, and then you can see the assistance underneath each of those different areas there. Just as an example, at the Board of County Commissioner meeting earlier today, there was a proclamation for Veterans Awareness because Veterans Day is coming up on November 11th, so they issued a proclamation today in honor of veterans. And so this is a real quick, down and dirty overview of the Public Health and Social Services Department. Again, encourage you, see which ones you want have interest in and come in, and we can link you up with our program staff and get you some in-depth information. Also, if you want just overall view of all the different areas, we can do that as well. Feel free to reach out and talk to us on this. Any questions on the overview of the department? Okay. Thank you.
Okay. And our next item is going to be what we discussed at our last, I don't know if you'd call it special meeting yet, is that what I'm referring to? Is coming up with a date and time for our regular meetings. And so we have with us a resolution put together based on the information that we kind of agreed on at our last meeting. And so, Kurt, are you going to cover that as well?
I will. So the resolution, as noted by the Board of Health at their last special meeting, broken down to regular meetings. Regular meetings would be on the second Tuesday of each month, beginning at 4:30 p.m. And these meetings until December 31st, 2022 will be held here in this room and also remotely. Beginning on January 1st of 2023, the Board of Health meetings will be held at the Board of County Commissioners meeting room at 3000 Pacific Avenue Southeast in Olympia, Washington. And then based on this, we also have the ability to have remote meetings and remote participation in the Board of Health meetings. And then it also allows for committees may be established by future action of the Board of Health to study, discuss, develop, or make recommendations on matters that come before the full Board of Health or otherwise act as directed by the board. And so that everybody's had an opportunity to see that resolution. It's in your packets, and I think it was sent out prior to this meeting as well. Any questions on the resolution?
And just as a point of process, are we going to vote on this tonight?
Yes.
And are we going to vote on this tonight before we select our officers?
That's in the order of the agenda, correct?
The order of the agenda, I just wondered if everything was hunky-dory, and I don't see Jane anywhere now.
I think it is appropriate for you to take action on this and then the appointments.
Wanted to clarify that. Okay, well, based on that, then I would entertain a motion to adopt this resolution as explained by Kurt that we agreed on at our last meeting. So the times and the dates. And I got a question.
No, I was.
Oh, okay, I'm ready.
Mr. Chair, I'd like to move that we approve the resolution setting the regular Board of Health meeting date, time, and location.
Okay, is there a second?
I'll second.
Okay, we've got a motion and a second. And again, I'm just going to say, does everybody here in attendance vote aye for this particular resolution? Aye. Does anybody vote nay? So the resolution passes as presented by Kurt. Okay. Next issue is selection of the chairperson for this Board of Health. And I guess we had nominations last meeting. And I think we've come to a consensus at that meeting who was going to move forward. I have to say that our current chair, Commissioner Menser, is not able to be here, but I believe he's still would like to be in the running for chair of the new Board of Health. And we didn't actually have a nominations committee, but we had quite a discussion. And I believe he was nominated by myself and seconded and accepted. So I'm going to try to make this as legal as I can with the Roberts rules. And that is, are there any nominations from the floor? And I think I have to say that.
3 times.
3 times.
3
I'll
times.
nominate Commissioner Ty Munster.
Okay. Any other nominations besides Commissioner Ty Menser? And I'll ask that one more time. Is that the rule? One more time. Any nominations from the floor for chair of the Thurston County Board of Health? The new Board of Health. Okay. Hearing none, it sounds like a train coming down the track because I don't know if he's going to lose this election or not. I don't think so. I think he's going to win. But all those in favor, would you please say aye?
A motion needs to be made, please.
I would move to appoint
Yeah.
Ty Munster as the chair of the Board of Health.
Second.
There you go. We got a motion and a second. So, is there any further discussion?
No, sir.
No further discussion? All those in favor, say aye.
Aye.
All those opposed? And I would note that so far, we've had pretty good unanimous decisions here tonight. No big controversy going on. Okay. Next up, and I think we have to do the same thing again. We went through this, and that's for our vice chair. And I, just as a little bit of history, what we got Robert, Mariah, Maria, that we had that discussion at our last meeting, and I think you decided it's going this way, or the train's over here.
I would nominate Maria Williams for vice chair of the Board of Health.
Okay. And I'm gonna ask for any nominations from the floor. And any nominations from the floor. And just to make sure, any nominations from the floor. Okay, Red, you're on the hook, so it looks pretty good. I think you're a shoo-in. I think you're pretty good. Anyway, all those in
Yeah,
favor?
please entertain a motion, Commissioner.
I thought we got a motion.
No, it was just a nomination.
The nomination.
I would move to designate the Maria Williams as the vice chair for the Board of Health.
Second.
Second.
Second. Doctor's making the second. Got it? All those in favor say aye.
Aye.
All those opposed? Again, I'm not making no unanimous decision. So
Incredibly efficient.
now we've got a vice chair, but we don't have a chair to turn it over to.
I think
Did I
you,
finish the meeting?
I think you may give the floor to the newly appointed vice chair. If, to her,
I don't want to put you on the spot. That would be the normal
Yeah.
activity. And don't worry, I'm glad to get rid of this. So, and you can see that I'm willing to pass it on to you, but I want to make sure you're comfortable too. Right.
I would be comfortable in the next meeting if you don't mind finishing this meeting, if that's okay.
then, yeah,
I believe that's probably permissible.
Right.
Sure.
go ahead, sir.
Okay, good enough. So, our next department item is meeting topics by board members. So, if anybody has some topics of concern that they think we should be paying attention to, we'll not only get it on the record tonight, but we'll try to get it on the agenda as well. So,
I have 2 suggestions.
yes, ma'am.
So, I believe I've already spoken to Kurt about them. The first suggestion is, I think it would be, as I've done in the community, I've met with the leadership for both Capital and Providence. And they've told me of several new programs that they've started, as well as updating on kind of what they're doing. I think it would be great to invite them over here for them to meet the new Board of Health members, as well as them kind of walk all of us through what their new projects are, and be able to get them more out in the community. I believe the projects that they're working on are very innovative and great. It would be just a great discussion topic. That's my first one. The second one is in regards to, I serve on the ORCA board, which is the Olympic Regional Air Agency. And they've been requesting a meeting with the Board of Health. I've let them know that we're going through this process of getting new Board of Health members, and therefore probably wouldn't be a good time to come in earlier and then have them come back. So, but I know that they've been wanting to come in and present on outdoor air quality, as well as their movements for indoor air quality as well. So those are just two topics at the top of my head from community organizations that have reached out.
Okay, would everybody agree those are issues that we ought to look into? So we're there. You got 2 on the list. Anybody else?
Budget. I said it last
Budget,
time. I'll say it
okay.
again. Yeah.
I am gonna comment just a little bit on budget, and I guess I'll let the county manager maybe refer to how this is gonna work with county budget, overseen by this board, and then there's some stipulations in the new legislation that says the Board of County Commissioners still retains control.
Yeah, thank you, Board Member Edwards. In the process, the Board of County Commissioners, they just made preliminary decisions on the 2023 budget. Within the overall programs, the Board of County Commissioners are responsible for is public health and the funding associated with it. Foundational public health was part of the conversation, and some of the initial conversations was to set aside a portion of the foundational public health for 2023, where the current Board of Health will provide recommendations to the Board of County Commissioners for the Board of County Commissioners to make final decisions on the allocations of that budget. I believe that's what you are recalling. I think the Board of Health has the option to provide recommendations in terms of what programs and what activities could be funded. I can't remember the amount, but I think it was about 300,000 on that neighborhood for 2023. And I think that will be probably one of the first meetings in 2023. The Board of Health can engage as to how that money can be assigned and provide recommendations again to the Board of County Commissioners for a final action.
So in advance of the meeting where we decide how we want to allocate $300,000, can we get more information on the current status of the budget, which will contextualize where we might want to spend those dollars or recommend the spending of those dollars to the commission?
Yeah. So I think what we want to do is, one, lay out the parameters of foundational public health. And so because Department of Health has certain buckets that you have to follow when you're doing foundational public health. The other piece is an overview, a macro overview of the budget, I think would be beneficial. But we also, what I was going to point out is we start biennial budget development next spring as well. I know public health staff who are watching will be really excited for me to say, get ready, we're going to start again in February. Because I think the Board of Health is going to be part of that budget development process as we brief you on all the different pieces and parts. Because the concept that I would recommend to the Board of Health is you budget, the public health department budget, that you recommend how that budget should, whether to the Board of County Commissioners. They have final action, but you can recommend policies, procedures, and budgetary items, similar to how EMS Council does. I know Commissioner Edwards is familiar with EMS Council. But I think we would start with foundational public health and give you the information on that so that you can make some informed recommendations to the Board of County Commissioners.
And I might follow up on that. The EMS Council, although there may be questions that are asked by the Board of County Commissioners when we are approving their budget, they have their own source of revenue, if you will. And so the county commissioners, I don't believe, have ever really questioned the need, as long as the EMS Council, and mostly it's always a unanimous recommendation. There's been a few times that maybe it has not been for one thing or another, but the county commission has always went along with that EMS recommendation. And I would guess that's going to be kind of similar to this, except we don't have a standalone revenue source just exclusively for us. We have a fair amount that's dedicated, like Kurt was talking about, that'll cover it, but it's not quite the same as the EMS Council, because we're gonna, every once in a while, we have some general fund that needs to be put in to do something, or maybe a topic will come up that wasn't quite listed, you might say. I'll just point out that today at our public hearing, today we had a couple citizens come in, and NARCOM was their thing, and they were looking for a better response to the needs so they could help the community. So something like that. I just use that as an example. Something could come up. I think that's good. I think we'll be right on top. Okay, we've got 3 things on the list. I don't know, does the county manager get to talk?
I only provide suggestions. Board Member Edwards.
Yes, sir.
My suggestion for the Board of Health to consider is to have a standing item. The Board of County Commissioners, over the last couple of years, they had a standing item on COVID response every week, evolving to every month. Now is a report on infections, diseases, which covers just about everything. Kurt and Dr. Adamalik provide that perspective. And in fact, we had that one this morning during agenda setting. I think it's more appropriate for that report to be done to the Board of Health. And you may consider having a standing item for Kurt or the new director, as well as Dr. Adamalik, to provide that monthly report on all the infectious diseases that the department deals with. That's my recommendation.
Okay. We got 5 on there. Kurt, go ahead, fire away.
I would make a recommendation, since our opioid response plan expires on December 31st, that we add that soon to the next agenda, because there's a settlement funding that's coming down, and I would propose that not only the opioid response plan be briefed to the Board of Health, but also the settlement details that is coming in and the funding that's coming in, because we do need a current opioid response plan in order to be able to be eligible for that funding.
Might you be prepared to present us with one so that we can adopt it?
Yes, we have what.
You have got it in place, an adjusted one?
Yeah, actually, staff will bring in a recommendation and be able to not only brief you on the settlement details, but also.
It's okay, the live stream is still going. As the Zoom.
And so, and yes, and we'll have a recommendation at the same time.
And when will you be prepared to present that?
At the next Board of Health meeting, if that's the desire of the Board of Health.
Yeah, I think that's great. Will you be able to get that out to the board members before the meeting?
Yes, absolutely.
Just look it over.
Absolutely.
Especially if it's long.
What's that?
Especially if it's long.
It's more than 1 page.
Okay. Good.
conversation about updates to the strategic plan? Although technically it does go until 2024. Some things have changed since 2019. So, just starting the conversation about updating the strategic plan.
Sure.
Absolutely. We'll let that as an agenda item. And keep in mind, I don't envision all these agenda items being on your next meeting. We will work with the chair
Yep.
and vice chair to get
Lay it out.
the relevant ones that you need to see first.
I know there's some strong feelings about strategic plans.
I wasn't going down there, but
Just the mere fact that it's a strategic plan. Is that what you're referring to? Okay.
I'll learn more with it after Dangerous Street.
As we go along, for folks that have issues that come up, you've got a chair and a vice chair to talk to. So make suggestions to those folks as far as getting things on the agenda. And go ahead, Madam Manager.
Board member, before you leave this topic, the Board of Health may engage on a conversation related to subcommittees as to, whether 2 board members or 3 board members can work directly with the staff, not necessarily waiting for a monthly board meeting where you can start working a little more in detail some of the elements of the department, along with staff. Maybe you engage this conversation today. You don't need to make a decision today, but you can provide direction as to how staff can bring recommendations. But maybe hear from the board members whether there's enough energy to have the subcommittees, what will be the number of the subcommittees, in what areas of the subcommittees the board members may be interested in participating. And then staff will bring some recommendation in terms of the makeup, as well as the frequency in which those meetings could occur. That's my suggestion for you today.
Can I push a little against that? I feel like we need to learn how to walk before we run, and I think we will need subcommittees in the future, but I feel as we're bringing up new members up to date on different aspects of public health, it'd be great for them to know the depth of just how big public health actually is before we start breaking it off into subcommittees and I think we need to gather that energy first, like you mentioned, before we jump right into that. I do see the value of them, but I don't know if, at least for me, my perspective, I don't see that worth it either.
I agree, and I think that as we get into some of the work, we're going to see quickly where we need more work, and that might drive the creation of the subcommittees, right? If we start talking about recommendations on budget or development of the strategic plan for the future, those might be areas where we want to bring together a smaller group to do some of the work outside the meeting, but we won't know until we start.
Yeah, we won't. The nice thing about a subcommittee is you don't have the formality of an official meeting and all the.
Yeah, and you don't need an OPMA, so it's more a little
That
bit
open public
yeah.
meetings thing will get you on occasion if you don't get it right, so. Anyway, more to come. I have to reflect Commissioner Mejia's position. Let's not get ahead of ourselves. Let's just get moving along and it'll all fall in place. And luckily, we're not dealing with a brand new pandemic like we were a couple of years ago or something.
Knock on wood, knock on wood.
Luckily, it's like
Let's knock on wood.
knock on wood, we're here, yeah. So I think this is gonna be a good deal once we get everything ironed out and get it rolling. So, it'll all come together. So, any other items that you want to put on that list right now before we move on? Hearing no other items. Kurt?
which always happens to me at least, 5 minutes after the meeting's over, I suddenly come up with like different ideas. If you have something, please feel free to email it to myself and the chair, and then we will make sure we get it into the list.
Okay. So at some point, we'll be pulling some of these out and getting them in line, you know, depending on what, for an example, the hospitals, who they're gonna designate, who's gonna come over, when they have time, all those things will come into play. Okay, so there'll be additional items, I'm sure, that come up. But number 8 on our agenda is Board of Health members' related activities and accomplishments. So we've been a designated Board of Health for 10 minutes. I don't know if you've solved anybody's problems yet, but I know that's gonna come in the future. So for right now, or any burning questions before we move on to Kurt's report and Dr. A's report? Did you have your hand up, ma'am?
Yes, sir.
I thought you told me you were in a hurry.
I'm sorry. Keeland, the Park Homeowners Association, I've been working with them. They've had, because they've worked with public health in regards to some septic matters. And so just as a heads up, I just might be requesting that to be added as an agenda matter later on. But I kind of just wanted to give, just so everyone's aware of, and it doesn't come out of left field. And then I wanted to touch base on the opioid settlement. With Thurston Drives, we had this conversation on better coordination within all the jurisdictions. At that time, we didn't know exactly where, kind of what the guidelines were. We know a little bit more. But one of the things that I heard was in regards to the opioid task force working on a more public Narcan station, almost like a vending machine type situation. And they've had discussions on trying to find a location for it, and they've been working on that. And just, again, something for us to consider as they're working through it. I know that they've been trying to find locations. They thought of schools first, but as they've been moving around, they've thought of other different locations.
Related to finding a good location, is there a way to use like GPS data for emergency response? Would we want to put it in the places where emergency response has gone to address
We can definitely look to see if they have that type of data in the EMS data bank.
Yeah, if they code their calls by overdose response.
Yes, so we can see if we can pull that information and get that in front of the Board of Health as a presentation as part of the opioid task force presentation.
When's the prosecuting attorney scheduled, you know, to come over and visit with us? Is Jane gonna give us anything, or John gonna give us anything, or have they expressed any interest on wanting to address this new Board of Health, or scold us, or give us OPM any direction, or anything like that? I wanna make sure we get it right at some point. Haven't heard anything about that?
You know, the prosecuting attorney's office is ready to support the Board of Health in any means and methods. So let me know what you'd like to see. We can accommodate
Well,
that.
I think, you know, Ty's got a great relationship with those folks.
Yeah. So, and I think they related to the opioid settlement. I think it's a good conversation to have. I believe the first installment to all the jurisdictions coming up in the second week in December. And, but as anything else, it has a lot of strings attached. And one of the biggest requirements is the utilization of those funds. In addition to be specific on the activities, it has to be done at a region level. But it's beyond the Thurston County region. It's a 5-county region. So that is going to create a little bit of interesting logistical challenges as to how we're going to be working with the rest of the counties. Perhaps the Board of Health or the regional Board of Health, just to have those conversations going. This is going to be a 17-year journey in terms of this the settlement. as a reminder, this settlement is only for the distributors. There is another settlement maybe in the works for the manufacturers, which I think is going to be a good process to go through just to make sure they, when additional money comes, we have a process in place to utilize it accordingly. But that may be a good conversation to have from staff or from the prosecuting attorneys to bring you a perspective as to where we are in the overall settlement. Again, the first one, the distributors have been set. We're just waiting to receive the allocation, and then we need to work in the process.
Any other comments on this? I think I'm just going to make mention of one thing for our next meeting. If all the board members would think about what they would like to see accomplished, if they've got a specific issue that we should maybe prioritize or be paying attention to, and bring that to our next meeting for that discussion portion, because I don't know if you're going to be out, you know, saving lives and all that type of thing as we move forward, but we're all going to be having concerns, I'm sure, you know. So for me, I'll just say, you know, this will be my first, I'll give you an example. I am very concerned about fentanyl in our community, and fentanyl that's disguised, and fentanyl that young people end up being afflicted by in some fashion or another, some very innocently, and some, we've had some young students that have had overdoses that took their lives, and I know they weren't historically drug-using kids. They just made a stupid decision like kids do. You know, somebody gave them something and it was a mistake, you know, and it was related to them, it was something else. Or it was gonna be, oh, this is euphoric, this is great, but it won't hurt you, or whatever it is. And I think that is an issue that is very underreported and under-discussed. That's my own personal feeling. We're gonna be over 150 deaths, overdose deaths this year in Thurston County. And from a county commissioner's perspective, that's hard on our budget because autopsies and all that, I mean, it's kind of callous to equate those deaths to dollars, but it's a reality that we end up dealing with. And 10 years ago, there might have only been 10 overdose deaths in that same period of time. So we're really seeing a devastating problem develop, and I don't think it's been dealt with properly. But what is proper? What could our role be to help focus attention to that? So that's my little issue, if you will. It's a big issue, I think, but it's my issue. And I would like to see all the new board members bring something. Have we been missing the boat on something that you think we should be doing more about to solve a community problem? I mean, if your thing is clean drinking water or making sure the kitchen at the restaurant gets inspected, I don't care what it is. It's just, I think we'll all be bringing forward issues as time goes on. But if you got any burning issues and you really think they're hot and they're gonna save some lives, let's talk about them at our next meeting, because I'm not gonna drag this out forever. I'm the outgoing vice chair here, so I'm gonna give this up, then I'll be talking from the bench, from
the bench.
Anyway, so, Dr. A, are you gonna give the report first, or is Kurt giving the report? What's gonna happen here?
So Dr. A is going to give the report. There is no direct report. It's just the public health officer is going to give a consolidated comprehensive report.
Just a brief update of where we're at. Thank you, Doctor.
Good afternoon, everyone. So typically, these our reports kind of cover that communicable disease information, some of which was shared this morning, as well as talking a little bit about other other diseases, and then as well as other topics, most commonly on the human health side as well. So that's typically what my reports consist of. Today I'll just go ahead and get started. And in terms of what we've been up to on the communicable disease front is our staff has investigated in the past month 125 confirmed and probable cases of a diverse range of diseases, ranging from Campylobacter to chlamydia and gonorrhea to hepatitis C, highly antibiotic-resistant organisms, monkeypox, measles, pertussis, as well as shigatoxin producing E. coli, and syphilis. So we do, we do watch these case trends fairly closely month on month. I wanted to take a few minutes and share a little bit about it being viral respiratory season and how we are seeing. So first things first, that our COVID community levels here in Thurston County are in the low range based on the CDC guidelines. We are at approximately 35.4 cases per 100,000 over the past 7 days based on BoH numbers. Our hospitalizations for COVID-19 remain low. We're at 3.5 cases of folks who've been diagnosed with COVID-19 who've been admitted to the hospital in the past 7 days. This is CDC data and it's up through November 5th. And so folks who have tested positive for COVID-19 account for, per CDC, 3.7% of our staffed inpatient beds and 4.2% of our staffed ICU beds. So this is much better than it has been in times past. I will say that that influenza, so we're in week 43 of the year, influenza rates are still low. It's predominantly influenza A that's circulating in our state. There have been 3 influenza related deaths in Washington state as part of this influenza season, and no reported outbreaks in long-term care facilities, which is one of the key. Not all influenza is reportable or reported to us, but outbreaks and influenza related deaths or novel influenza gets reported to us at public health. We as a public health department have been, acknowledging that there are multiple circulating viral respiratory pathogens, have been doing some forward planning on outbreak mitigation and have had some messaging on vaccination. COVID-19, there's a bivalent booster available that we recommend that folks get so that's for folks who had a primary series 2 months after their last dose, become eligible for the bivalent booster, or 2 months after their most recent monovalent booster. And so we're looking at we have seen increased COVID rates in winter months in the last 2 years. Influenza also there is a vaccine available for it, and based on our what we're seeing preliminarily, talking to our state and federal partners, it looks at this point like the influenza vaccine is a good match for what's currently circulating. So I highly recommend that folks who haven't gotten their flu shot yet definitely get their flu shot. So there are lower levels right now of COVID-19 and influenza. In Washington state, we are still seeing significant respiratory illnesses, including RSV, and our hospital, we are seeing some hospital strain, especially in pediatrics hospitals as a result of this. And we are seeing, clusters of folks with viral respiratory illnesses. So really just want to make sure that that folks in our community who are listening in know to stay home when they're sick, and wait until they feel better and are fever-free for 24 hours without using fever-reducing medication, even if it's not COVID. Taking that time to rest and get better can definitely prevent someone else from getting sick. And then, when out in public, making sure to wash hands, frequent hand washing, covering coughs, and all of those basic respiratory etiquette that we've been talking about since the pandemic began works for COVID, as well as multiple other respiratory pathogens. So we do continue to watch those trends as well. I did want to brief folks a little bit on monkeypox or MPV. We are, as a state, we've seen a significant slowing in the rate of new cases. So to date in Washington State, there have been 627 total cases and 18 hospitalizations of folks with monkeypox. There have been 2 cases so far in Thurston County residents. This is a disease that's spread predominantly through close contact, close contact with folks during their infectious period, which is when they're symptomatic. There is a vaccine that is effective at preventing monkeypox, the Jynneos vaccine, and to date, Thurston County has administered 283 doses of the vaccine. At this point, risk to the general public from monkeypox is very low. The folks, in terms of spread, the community most affected at this point is the community of men who have sex with men, as well as folks that may be affected or engaged in sex work, as well being some of the folks most commonly or most at risk. We are able to provide vaccine for people who fall into high-risk categories, so they can call us at Thurston County Public Health at 360-867-2610 to get scheduled. We're also able to arrange for vaccine for folks who are close contacts of someone who has had monkeypox or MPV. So with this vaccine, ideally, if folks can get vaccinated and initiate the process within the first 4 days, that's your best chance of preventing disease. And then within the first 14 days, you have a good chance of reducing symptoms if you did become infected. And we're able to support folks who might need that vaccine. Moving a little bit, I would like to close a little bit away from communicable disease, but also in the same vein of just information that I really want to share with all of you, and I also would like to share with folks who might be watching the live stream. And that is that our Food and Environmental Services staff completed the investigation of 2 cases of folks with high blood lead levels. The reason why I mentioned this is that one of the investigation revealed for one of the cases that an ointment that was manufactured and sold in a different country was the precipitating factor for that high blood lead level. And this is just a reminder to folks in our community that products that you might get online that don't undergo our regulatory process might have things in them that that wouldn't be sold here in the state. So just want to urge for folks when they're as you're using different ointments and things like that, just to be mindful of what you're using. And with that, I'm open to any questions anyone may have. Thank you so much.
Are we hearing any concerns about a new variant? You mentioned that in the winter months, we've had resurgence in COVID cases, and last winter, in January, I remember Omicron was huge. We saw just these spiking case counts throughout Thurston County. Have we heard that there's another variant on the horizon, or not so much?
So there are new variants on the horizon that are actually gaining ground. So in terms of so for Washington State specific data, there's a little bit of a lag time. So what I'm sharing is from samples collected the week ending October 15th. Just because sequencing takes time. We continue to have BA.5 be the dominant factor here, so accounting for 78.2% of cases. And this is followed by BF.7 being our second most dominant variant. Across the and then I believe that's followed by BQ.1. We are seeing some of the we are seeing different variants. These are all from the Omicron family. So when the spike that we saw was due to that huge shift in transmissibility with Omicron, and we haven't seen significant shifts thus far in these new variants of anything of that magnitude. But similarly, what's also reassuring is we're not seeing a safety signal in terms of, our death rates aren't rising, and we haven't seen a significant spike thus far in COVID-19 related hospitalization rates.
One more question, I'll just keep asking questions. I'm not sure if this is normally something that the Board of Health supports or oversees, but I know during COVID, when COVID was more threatening in the community, the county assisted with community vaccination clinics. Have we thought about doing those even as the pandemic is waning for things like flu shot and booster, or as we call it at my agency, the fluster? We offered an agency clinic recently where you could get the flu shot and the bivalent booster at the same time. I got both in the same arm, but you get it all out of the way at once. Have we thought about making that kind of clinic available to the community? And do we think that people would turn out for it?
So we do continue to be able to provide COVID bivalent boosters in the community. Flu vaccine is distributed a little differently. So at this point, we don't. We act as a vaccine depot, so we can store vaccine for other for other folks in the community who might need it. But at this point, we don't currently have the capacity for flu immunization through PHSS.
Okay.
How we doing? Anybody else? Anything coming to mind? I gotta cut Robin off or she'll wear us out.
I have no more questions, sir.
Anyway,
Can I make a comment just about the community with just what all is going on?
Doctor, you can say anything you'd like.
So I guess I would just reflect that there is a real challenge right now with doing all these vaccines on top of all the work that's going on with the workforce problems that we're having. And so, I do worry that people are having to wait longer to get a flu vaccine or something. We do them on the fly all day long, anyone who's in the building, and we have our clinics on top of that, but they're still like booking way out. And so, if there were ways to partner or, have volunteer staff or things, we could probably do more quicker. So, if there were things where you wanted to have it like at certain sites around town on a weekend or something, you could probably get them done a little quicker.
Yeah, I know that the county was calling for volunteers, because I was on like the volunteer call list for the big clinics that were happening at SBSCC, so having something like that, if we could distribute flu vaccines and call for volunteers to spread the medical credentialed staff a little further.
Yeah, because I mean, if you want to protect it in time, like now's the time, and that's the hard part is we're dealing with so much illness and stuff right now. It's such a battle.
Yeah, and if I may,
Yes, sir.
and unfortunately, everything comes down to dollars and cents. And I think where Dr. Abdimalik stated that we don't have the bandwidth, perhaps, the resources, is because we don't have the funding. The funding is going to be ending here. There's a little bit of money to continue to help those clinics. But embarking on a large community clinic at this point requires a lot of resources and funding. And so always is that balance that we need to go through. It certainly will be up for the challenge when the time comes, and we'll still continue to monitor the opportunities.
So maybe next year.
Yeah, it might be a good thing to plan for, and then maybe have just a few community huge events in that like September, October next year or something. I thought.
Okay, I think we're just about wound down. So, I think you'll have a new chairperson. And he does a really good job too, so you'll be able to follow along and he'll get you down the straight and narrow. So, okay, next time around, we've got it all set.
Just one logistical questions for the board members. We're going to be circulating the resolution that you just approved.
For signature.
How will be more convenient for you to sign that resolution?
Do you have a hard copy of it here in the room today that most of us
Yeah.
could sign
Yeah,
before we
let's
leave?
sign it.
Okay, thank you.
Pass it on.
Look at that, Jimmy is on top of it.
Pass it all the way around? Patience.
Yeah.
Oh,
Sign it first.
Oh, okay.
Commissioner Edwards, you want to adjourn?
Pardon?
You want to adjourn?
Yep, I'm ready. You gonna make a motion to adjourn?
I don't think we need a motion.
Okay, well
You're the chair.
then we are adjourned. Good enough.